So a hernia is where you have a defect in your abdominal wall usually, and what happens is that the contents on the inside of your abdomen, your bowel, or even your intra-abdominal fat can get pushed through that opening, and you kind of see a bulge. Most of the time, they're not painful. Usually, patients, when I see them, they just say that I notice this bulge that kind of comes up, and then when I lay down or relax, it kind of goes away. The risk is that if you don't fix it, the hernia could get larger in size, allowing more contents to come out. And then in the worst case scenario is where you have bowel that gets trapped, and then essentially it's choking off the bowel or causing ischemia to that segment of tissue, which can then cause pain. Anyone that had a prior surgery history is at risk for hernia, especially those that have major abdominal surgeries with the big incisions. Those incisions are going to heal, but because you've had a incision there where they separated that musculature, it's going to be a focal point of weakness. The other big risk factors for hernia development is a significant smoking history. Those patients that have obesity or diabetes, and then the ones that aren't any type of immunosuppression medications, including steroids, long-term steroids specifically, just because that all affects the way your tissues heal. Usually when we see patients that have hernias, we work them up by standard physical exam, and then depending on the location of the hernia and what the exam findings show, we may get a CAT scan to further delineate the anatomy and give us a better idea of what to do surgically. Most of these now are fixed robotically, and so you'll get very 1 centimeter or half centimeter incisions where we go in there, and essentially what we do is the hernia contents, we reduce those contents back into the intra-abdominal cavity to where they should be, and then essentially you think of it like a hole in the ceiling where we're going to close that hole. So we use the robot to help us suture the hole closed, and then we put a piece of mesh there that reinforces your abdominal wall and helps it seal completely. The recovery time is usually about 6 to 8 weeks. And the reason it's that long is because we really need that entire abdominal wall to fully heal. So traditional or open surgery is where you make a big incision over the entire defect of the abdominal wall. You then go in there, reduce everything like you normally would, and then you suture everything closed. With the robot, we do the same technique, except we do it with 1 centimeter incisions. And so the incision is definitely significantly smaller. That helps the patient in many ways. Number one, the recovery time is faster. You still have to wait the 6 to 8 weeks for heavy lifting, but you're still up, back to your daily routine, back to work a lot faster. And so I've had patients go back in a few days just because they're not as in much pain, really, from not having to have the big, long incision. The other thing is that because you're not having to do that big, long incision, the risk of wound infections are less, right? So therefore, your chance of getting a recurrent hernia is less. Number two, cosmetically, also, it just looks a lot cleaner. So patients, when they do get back to their daily life, they just feel better.